We have cracked the code on lower cross syndrome. Lower cross syndrome is a problem that people have with back pain, and it happens with them consistently. If you sit for long periods of time, then you likely have lower cross syndrome, and unfortunately, most of us sit for long periods of time. So we're gonna talk about the 5 main symptoms and a clear fix, something you can start doing today to start fixing it. The number one symptom, first thing we're going to talk about with lower cross syndrome, is an anterior pelvic tilt. So an anterior pelvic tilt is my pelvis being tilted like this. So I'm stuck in back extension right here. There's a lot of muscles that are involved with this, but if I have tight hip flexors, I have an anterior pelvic tilt. Looking at this spine right here, if I go into extension, I'm gonna close down this space for these nerves to come out. And so we've got to address that. An anterior pelvic tilt is not something that's good for us. We need to be in a neutral spine position, and we can only do that by being neutral in our pelvis. The number 2 symptom is tight hip flexors. So right here, this is the major hip flexor in our body. This is our psoas major. We call it the Iliopsoas. This is the iliacus, this is the psoas. So together, this is the biggest hip flexor in the body. We have other ones, but this is the one we want to address because it's directly connected to the spine, and it pulls us into that anterior pelvic tilt. What you're going to see with lower cross syndrome is that all of these things build on each other. That's why it's called a syndrome. We have multiple things going on. We need to break down what those things are and then how we get out of it. So that anterior pelvic tilt and then tight hip flexors are going to start that cascade of creating this syndrome. Number 3 is inhibited glutes. We're not able to use our glute muscles as effectively as we should be. We have reciprocal inhibition in the body. So reciprocal inhibition, it sounds like a funny term, but really it's about a muscle on one side being tight will inhibit the function on the other side. So if I flex my bicep as hard as I can, my tricep has to be loose. So if I have really tight hip flexors, then I can't fire my glutes as effectively. One of the major functions of our glutes is hip extension. So if my hip flexors are really tight, when I try to squeeze my glutes, it's just being inhibited because my hip flexors won't allow me to go into hip extension, so I can't use my glutes as effectively. And if I'm not using my glutes effectively, then we're gonna have a ton of other things that are happening that are causing stress on our low back, and that's why lower cross syndrome is so important. Number 4 is tight overactive back extensors. So now if I'm not using my glutes effectively to get extension, then I'm gonna be using my back to come up. So think about this. When we're standing against gravity, our body has to stay upright. So we are challenging. To get stability, we need stability here in our deep neck flexors. We need them in between our shoulder blades, at our abdominals, and at our glutes. Now, to stand upright, if I'm in an anterior pelvic tilt and I have tight hip flexors, then to stand upright, I don't want to be tilted forward like this. I'm going to be using my back extensors all the time. If I'm just trying to stay in neutral, I'm still going to be using my back extensors because my body's trying to pull me up to stay vertical. And so I have tight back extensors, and that's going to be a problem. So I'm pairing that. My tight hip flexors create tight back extensors, and I need to be able to use these muscles more effectively. So I've got to get out of those tight back extensors, out of the tight hip flexors, which is the hallmark of lower cross syndrome. Number 5 is inhibited abdominals. So our abdominal muscles are not functioning as well as we need them to. So a lot of times we hear in marketing, in the gym all the time, it says, hey, if your abs are strong, then you won't have back pain. What we've seen in the clinic is that's just not true. We have clients that come in, they have a ton of back pain, they have really strong abs. When I was younger, I had a chiropractor tell me that if I could do a plank for 3 minutes, then I wouldn't have back pain. It's simply not true. I got up to 5 minutes of a plank, which was horrendous and difficult, and I still had back pain every day because I had lower cross syndrome and issues with my back that I wasn't able to get out of. So if my back extensors are tight, we talk about reciprocal inhibition. If my back extensors are tight, then it inhibits the function of my abdominals. If my hip flexors are tight, then it inhibits the function of my glutes. So when we look at this model right here, I'm tight here and I'm tight right here. So that means I'm not going to be able to use the muscles right here or use the muscles right here. And that is the reason why lower cross syndrome is so important. We sit for long periods of time, and we end up having problems with those muscles. We need to change that. We've got to be able to fire our abdominals right here, and we got to be able to fire our glutes. And when we get those fired up, we can use reciprocal inhibition to our advantage. We get our glutes fired up so much that it doesn't allow our hip flexors to tighten up, and we get our abdominals fired up so much that it doesn't allow our back extensors to take over. Then we're standing against gravity, right? And then I've got my deep neck flexors, I've got my shoulder blades pinned down and back, I've got my abdominals firing, and I've got my glutes firing. Then I'm able to keep my Superman, Superwoman emblem and my belt buckle stacked, and I'm able to move in these positions so I'm not constantly in back extension using those back muscles. When we do that consistently and we move through those patterns, then we have way less back pain. Most of our clients beat it altogether. A clear fix to getting out of lower cross syndrome is not using our back extensors. So we've got to retrain ourselves, especially in the gym when we're loading with weight. If our back extensors are taking over, then we're always going to have a problem, because the biggest muscle group in the body is the glutes. We want those to fire really well, and we want to be able to get through full hip extension. So if I'm doing an exercise and my head is coming up, now my head is leading the motion, and my back, I can feel it right now that my back muscles have tightened up. So I'm leading the motion with my head and my back extensors. I'm not using my glutes. So we always got to be thinking about what's happening on the bottom half of our body. We've got to get out of that back extension, stay in a neutral position with our lumbar spine, and then train in that neutral position. So the first thing that we think about when we're in the gym or we're around the house, we're just lifting things up, is keeping our head in a neutral position. So I'm reaching back with my hips, and my head stays in a neutral position, and I'm coming back up. So my hips are leading this motion. So I don't have any change in angle of my spine when I do that. So I'm not feeding into that bad position of lower cross syndrome. If you're sitting for long periods of time, we've got to loosen up those hip flexors and use our glutes. If we're loosening up the hip flexors and using our glutes consistently, then you're going to be able to beat lower cross syndrome, but it's got to be on a consistent basis. So the main thing is to understand what these symptoms are, what the signs and symptoms are of lower cross syndrome, so that you can actively take control of your movement patterns. And we do that by doing a hip hinge. So our clear fix, a great hip hinge, has multiple different facets to it. And the facets are that my face stays in a neutral position, so my neck is not leading. My back stays in a neutral position, so my entire spine, if I took a rod and put it through the top of my head and then it came out of my butt, there wouldn't be any change in angle right there. Now we know that we have a little bit of a curve here and a little bit of a curve here, but don't be too concerned with changing your pelvis position. Just be focused on using the right muscles and maintaining neutral. So I'm addressing my head right here, my neck, my spine, and I'm reaching back with my butt. Your lower leg should be like a stake driven into the ground. It goes straight down. So that we're reaching back with our butt and we're using our hip extensors, which will be our glutes and our hamstrings. So I'm reaching back right here. A lot of times what we'll do is we'll put our hand in front of our face so we don't lock eyes past ourselves. So if we lock our eyes on the wall, then I'm naturally going to go into back extension. So what I want to do is put my hand right here, and then I'm watching my hand as I come down. So taking that little trick and reaching back with my glutes, keeping my lower leg vertical right here. My lower leg stays vertical. I'm reaching back. My knees are bending, but they're not leading the motion. My hips are leading the motion. So always think about doing a booty bump and dancing like this. Or one of my kids, I got a 5-year-old that I'm trying to reach back and shove him backward. And then he's just mustering up the strength, and he's going to push me back up with my hips. So it's right here in the crease where my butt bone is that I'm pushing back with my butt bone, and then I'm generating my force to come up through the hips right here. So if I'm doing that movement pattern consistently, we want to do 2 sets of 15 reps, and we do it on a consistent basis. It's going to be challenging because this isn't a natural movement pattern. When we are sitting for long periods of time, our hip flexors tighten up, our back extensors tighten up, then we just naturally start moving through our back extensors and we stop using our butt. We've got to retrain that. So twice a day, 2 sets of 15, so 30 reps. We're working on this, and we really like to reach back against the wall. So I'm going to use this model. I'm reaching my butt back. A good measurement is taking your foot length away from the wall and then reaching back, just acting like this is the wall right here, touching and keeping my hand right here. I'm reaching back and then I'm pushing forward with my hips, but my hips are leading the motion. Now, if I do it against this wall from the front, I'm gonna measure my foot, slide that foot over to the side, and then I'm gonna keep my hand in line with my face. I'm reaching back, touching the wall, and coming back up. When I'm touching the wall, it's like I'm kissing it. I'm just barely tapping it, reaching back and coming back up. And at the top, make sure that we're not overextending in our low back. So when I come up, I don't want to come up to here and go into back extension. I want to limit that, so I go to a neutral position. Think about taking 10% off of the top of it. So I'm coming here, and then all the way would be here. I'm gonna come back up and stop right there, just to neutral, to a comfortable position. Once more in front of the wall, I'm gonna reach back with my hips and then push forward consistently. And so I'm using all the right muscles and I'm retraining my body to do the right movement patterns, so I'm getting out of lower cross syndrome. Make sure you subscribe to this channel and hit the bell icon. We're not gonna bombard you with videos. We only put out 2 a week, but we don't want you to miss out on any of this information, because it's gonna be exactly what you're dealing with and all the contributing factors. So if you wanna live a healthy, active lifestyle, this is the stuff that you need to know. Check out the videos here on the screen. We're gonna give you more information on exactly what you should be doing, what stretches you should be doing, and what exercises to get out of back pain. See you in the next video. Get mobile and stay active.